oxygen-related parameters decrease, so you will have a false decrease in oxygen-related parameters and increase in carbon dioxide. So what you can do to prevent this kind of errors, you can be using self-filling syringes. So those syringes are filling due to the high pressure of arterial blood, and they will not fill easily if you puncture a vein. You can also use short beveled needles because they are easier to position within the artery. Contamination with air bubbles is quite common in our everyday work, we all know that. To address this, it is extremely important to inspect your sample prior to mixing and immediately after the blood sampling. So immediately after you do the blood sampling, you need to inspect your sample. If a sample contains bubbles, you need to gently tap the syringe, and this will expel the bubbles, and you will be able to get rid of those bubbles. There are, of course, syringes with vented tip caps that will allow you to do that without getting in contact with blood. The point is to get rid of these bubbles as soon as possible, because if bubbles remain in your sample, there will be a gas exchange between the bubble with the atmospheric air and your sample. And what will this do to your sample is this will increase the oxygen content in your sample and again decrease the carbon dioxide. Type of anticoagulant. The choice of anticoagulant has been also recommended by CLSI guidelines, and basically what we should be using is lyophilized, balanced lithium heparin. Why lyophilized? Well, because liquid heparin will dilute your sample, and you don't want to dilute your parameters. Why balanced? Well, because heparin is negatively charged, and heparin binds cations. And cations are in your sample, calcium, sodium, potassium. So if you want to measure cations in your sample, for example, calcium, then your calcium will be falsely decreased if you use a regular non-balanced heparin. This is why heparin is saturated with those cations in order not to bind cations from your sample. This is what we call balanced heparin. So you should be using syringes with lyophilized balanced lithium heparin. And the recommended concentration of heparin is 20 units per milliliter, and it is not recommended, and I know this is practiced in many hospitals and also in several departments in my hospital, to flush the syringe with therapeutic heparin. This is not recommended because the concentration of this heparin is much, much higher than what is recommended. And please do not forget that heparin also contains internal oxygen pressure, so the excess of heparin will increase dramatically the oxygen concentration in your sample, and you don't want to have this in your sample. What will liquid heparin do to your sample? This is just to illustrate how liquid heparin affects the different parameters in your sample. So it will decrease the carbon dioxide, increase, as I said, because heparin contains atmospheric oxygen pressure. It will increase sodium if you use sodium heparin. This is why you should be using lithium heparin. And it will dilute potassium, calcium, and magnesium. So you don't want to use liquid heparin, and you don't want to flush your syringes with neither therapeutic or any other heparin. Sample hemolysis, Anna has been mentioning already hemolysis. Causes of hemolysis in arterial blood samples are numerous, and most common causes are due to the poor blood sampling technique. So you either apply too high pressure if you don't have those self-filling syringes, if you have to pull the plunger manually and you apply pressure which is too high, or your needle may be too narrow, so again you have high turbulence during the blood sampling. If you do the milking during the capillary blood sampling, you will again have hemolysis. If you do vigorous mixing, instead of gently mixing your sample, if you do excessive shaking during sample delivery, pneumatic tube transport, and ice. Ice can be a source, a significant source of hemolysis, and this is why you don't want to use your ice cubes for cooling your sample. If you need to cool the sample, then please use the slurry, so crushed ice, because if a sample comes in the direct contact with the ice, it will most probably hemolyze. Hemolysis is a significant source of errors. I don't know if you can read this table, but I can, and I will tell you that hemolysis can be a cause of significant bias for oxygen and carbon dioxide, and this bias is 4.9, so almost 5%. And I'd like to remind you that in the beginning of my talk, I did say that we are willing to allow only 1 to 2% bias. So hemolysis is causing bias also for blood gas parameters, and we are always concerned about hemolysis and potassium and LDH. Yes, hemolysis does a lot of damage to potassium and LDH, but also hemolysis can affect blood gas parameters as well. As I said, excessive milking. So if you milk the finger instead of arterializing it, if the patient has a poor perfusion, you will most probably have hemolyzed sample. And this is again a case of a same patient with only 2 minutes time difference in a resting state. Actually, one hand was arterialized and the other hand was not arterialized, so you had to apply excessive milking to obtain a sample. And if you look at the potassium, I'm sorry, it's not working anymore, but if you look at the potassium in the sample obtained without milking, the potassium is 3.76, and if you look at the potassium when milking was applied, then you have a much higher potassium concentration and much lower calcium due to the sample dilution caused by interstitial fluid. So do not milk your fingers, do the arterialization instead. And do not use fingers because urolob is recommended. And finally, sample transport and handling. Well, I would just say keep calm and create urgency. So make it as fast as possible, but be as gentle as possible. This is actually the key to sample quality. So if we look at the variables that can affect the quality of your sample during handling and transport, there are 4 or 5 different things that you need to keep in mind. First is to mix the sample immediately after the blood sampling. Of course, before that you need to inspect your sample for bubbles, and if any bubbles are present in the sample, then you should first expel the bubbles and then do the mixing. So mixing the sample is done properly, gently, so be gentle, and by inverting the syringe several times and then rolling between the palms. So this is how you correctly mix the sample. If you do not do that, you will have clotted sample, you will have false elevation of potassium, and most probably you will also have analyzer malfunction due to clots entering the system, and you don't want that. How samples should be delivered? Well, samples should be delivered, of course, as soon as possible, but not later than or within 30 minutes from the blood collection, in a plastic syringe. So you should be using plastic syringes, not glass syringes, and at room temperature. Why room temperature? Because plastic will contract if you cool it, and the pores in the plastic syringe will enlarge, and there will be a greater exchange of gases between your sample and the atmosphere. So to avoid that, plastic should be transported at room temperature. Of course, it should be transported by hand, and vigorous movement and shaking should be avoided. After your sample has reached the laboratory, then again, depending on the time from the sampling and the analysis, you should again mix your sample once again prior to analysis to ensure that your sample is homogeneous. And so again, mixing should be done as I showed you. And mixing should be longer if you notice that the sample has been visually sedimented. So if there is already a sedimentation occurred in your sample, then you should mix your sample longer than just a couple of rotations. And finally, last but not the least, once you're done with the testing, you need to remove sampling device. Please keep in mind that needle stick injuries are a source of bloodborne infections. So to avoid this, safety devices are recommended, and protection devices for the safe removal of needles. This is how you should properly mix the sample. So to summarize, there are a lot of steps and a lot of things that we need to keep in mind. And I think that all of you may have been watching those